It's UofL Today on 93.9 The Ville. Here's your host, Mark Hebert.
Welcome to UofL Today with Mark Hebert on 93.9 The Ville, the program that's about all the stuff going on at the University of Louisville. And I'll tell you what, before we get rolling today, I want to remind you that you can find all the news going on at UofL anytime you want to. UofLnews.com is the place to go for videos, calendar of events, and stories about what's happening on our campuses at the University of Louisville. So what's on the show today? Well, older adults who are taking lots of pills aren't heeding the warnings about taking them with alcohol. That's one of the findings of a study from a couple of UofL faculty members, and you'll hear about that study. And it's the wave of the future, but it's actually here right now, using 3D printing in heart surgery. The chief of UofL's pediatric surgery unit will be here to talk about that. But first, you may have heard of esports, playing video games taken to a new and more competitive level. Mary Hums is a professor in health and sports sciences at UofL. Is here to talk about esports and whether your 13-year-old son or daughter who's a gamer is an athlete or a couch potato. Hi, Mary.
Hello, Mark. How are you today?
Good to have you back on the show.
Thank you. It's always good to be here.
All right, esports. How do you describe esports?
Yeah, when I think of esports, I think about the competitions like, League of Legends and some of those. I mean, that's my framing of it.
You play those games all the time, don't you?
I
Every
am
night
not.
at home?
I know I know. The funny thing is talking about esports, and I am by no way, shape, or form, a gamer.
gamer.
I would say, is Game of Thrones an e-game? No, it's not an esport. Okay, but it's those sort of the ones that we think about, the teenagers playing that are on for hours. The competitions, but this is not just about kids playing video games in their rooms anymore. When you and I were growing up, I don't know if you remember. Do you remember the very first video game? Remember Pong? Pong, the thing.
Oh,
that,
Pong, yeah, the
little lever, the little lines that went
Pong,
back and forth.
Pac-Man,
and then
the star thing where you shot
Galactica.
Galactica,
yeah.
Those are the ones,
All right, so that's and that is so vintage now.
Yeah.
I mean, just so vintage. But that's how it started. And of course, now it's a lot more complicated, and it's a lot more involved, and there's a lot of money involved with it as well.
It's big time.
Well, it is the last number I saw was looking internationally at about a $900 million industry.
Oh, my goodness.
Yeah, so it is really taking off. And we're talking about major sponsors, Intel, Coca-Cola, Red Bull. You probably would figure maybe Red Bull and those are some of the main ones. Mountain Dew is in it as well.
Right.
So there's a lot of money to be had. And the persons who compete, notice how I called them persons who compete, because we'll have that discussion, I'm sure, in a minute, about whether or not they're athletes. We're talking about people who can be millionaires by the time they're in their teens because of the skill that they have.
And it takes a lot of hand-eye coordination because you're watching a screen and you got the little gaming control thing.
Yes.
But I don't know. I just have trouble viewing them as athletes. So how do you describe them in your classes and when you're talking about this with your sports management students? Do you call them athletes?
I tend to call them e-sport competitors.
Okay.
Which I think
is fair. That's fair.
Yeah, it's pretty generic. Are they athletes or not? Well, and are the games, are they sports? Are they games? Are they activities? What are they? So that's another aspect to look at.
I think I'd call them games.
Yeah, I would consider them games. I would consider the people who play them to be competitors.
Right.
But there would be people who would say they're athletes. Now there is like you mentioned, the hand-eye coordination, but there's also the concentration. Could you imagine sitting at a console? All those you do this for a living. You sit at a console.
Yeah, but not like that.
No, can you imagine?
I'm mingling with people.
Yeah, and the amount of concentration that it takes, the amount of training that they do. Some of these teams, these international level teams. They will have houses where they live, where they have setups where they can compete right there, so they don't have to go to a studio or to a certain location. To practice. So it is amazing. So if you look at it that way, at the amount of time that they spend on their craft, one could say, well, how much time does an NBA player practice?
Right.
How much time does an NFL or Major League Baseball player practice? Well,
these guys practice a lot too.
A lot, yes, they do. And you did say, and I'll go with you on this if you don't mind. You said these guys. It is it's a predominantly male sport, and there are some issues.
I would guess 95% at least, isn't it?
Yeah, and there's some pretty serious issues with sexism when women who compete identify themselves, because you can come up with your own
Their screen name or whatever.
Yeah, I mean, I could call myself Card Warrior or something,
Right,
and no
right,
one would know
right.
if I was male or female.
Right.
But for women who do, or girls who identify as female, a lot of times, the bullying and the sexism that's out, it's amazing because you think that would be a game, I call it a game, where gender doesn't matter in the competition.
Yeah.
But we still see it.
Yeah.
We still see it.
We're talking to Mary Hums, who's a professor in health and sports sciences at the University of Louisville, and she teaches classes in all sorts of sports management and those kinds of things. When you look at Louisville and the University of Louisville, do we have any teams in the esports? Are competing in any esports leagues?
Not that I'm aware of, and I went online, and there is a Cardinal esports group.
Okay.
And when you look at their mission statement, like what they're about, it's about getting gamers together. It's not like, I think WKU has competitive teams, and of course, there is a National Association of Collegiate gaming.
Yeah, there is.
There is one. It's NACE, N-A-C-E, the National Association of Collegiate Esports, and it's got over 100 member schools, and about half. It's interesting when you look at their information. About half of them are NCAA schools, about half are NAIA schools, and then you get a handful of NJCAA schools that are in there as well. So there are over 100 members in that, but it's not. I don't see it on the horizon as an NCAA emerging sport. No,
NCAA sanctioned sport.
No, although I don't know if you knew this or not, but it is now a state championship sport from the KHSAA.
I did not know that.
And I believe it was Boyle County, I think, won the first ever KHSAA state championship in gaming, and that's pretty new.
All right. So, and we're two oldsters here, so we may not be able to speak in the language of the kids, but do they have to be in the same place? In other words, do you go to an arena and you set up screens and they compete against each other, or can they do it remotely? Since you're talking about games, like my son goes down the basement and he's competing against some game against some kid in Pakistan or somewhere.
Oh yeah. Well, that's sort of one of the wonders of the activity is that you can do that in either space.
Right.
So, for example, you talk about your son.
Right.
You could be in one location doing that. You could be watching these games on Twitch. I mean, like millions of people watch these. Go on Twitch.com.
Twitch.com.
Yeah,
okay.
and just have a look.
Okay.
So you can be remote. You can be watching. You can be competing. Now, on some of the competitions, the gamers will actually come together, and Madison Square Garden has sold out. Staples Center has sold out, where people will come and watch in person. So they'll be able to, project the images up on the screen. The competitors are right there. It's interesting. I mean, they sell kit and logos. Just like teams do.
See, I don't get that. It's like when you turn on ESPN and you're watching the World Series of Poker, and there are people watching the poker players. I'm going, really? I don't get this one. I'm missing it here somewhere.
You and me both.
Yeah.
Because I don't.
But apparently, lots of people do.
Yes, they do.
Since it's a $900 million industry or something.
Yes.
Something like that.
Yes, internationally, and of course, other countries are more ahead. Particularly. South Korea has seen a large number of these competitions before we had here.
So what is the future of esports? Obviously, it's going to get bigger, I think, as more and more gamers come online and more kids are playing these games. A, is it sport? And B, will it be part of not just Paralympics, but the regular Olympics or the Bluegrass State Games or any of those kinds of things?
It's already in the Bluegrass State Games.
Is it really?
Yeah, it is.
It is.
Yeah, it is. But the reason why there will be it'll be slower movement into the slower gains into the Olympic movement is twofold. Number one, there is no one international federation for esports. And in order to be in the Olympic movement, of course, you have to have a designated international federation. Okay. So that's one aspect that holds them back. The second aspect is that some of the essential ethics and virtues and values of the Olympic Games would be opposed to the violence that we see in a lot of the games. And so that's also, when the IOC president, Thomas Bach, made some statements about it, he mentioned those particular items.
Right.
So I think that would slow it down. We're almost seeing it more on the grassroots level than we are on the big internet, at least in the International Olympic Committee level.
Right. Okay. Well, Mary Hums, good luck with your study that you're working on. Older adults take more medications than young folks. We probably know that, right? But what happens when those older adults mix medications with alcohol? Rachel Vickers-Smith is an assistant professor in UofL School of Nursing, and Dee Antimisiaris is an associate professor of pharmacology in the School of Medicine, and they have looked at this issue. Ladies, welcome. Good to see you.
Thank you.
Hi, Mark. Thanks for having us.
Sure. All right. Pharmacology and mixing booze with pharmacy. Why don't you talk about your study and what you were looking for?
This was a study that was done, started several years ago at University of Kentucky with a colleague named Vickers-Smith, who now works in Maryland, is it?
I think actually Virginia.
In Virginia.
Yep.
One of those eastern states.
One of those.
Yeah.
Okay.
Yep.
But so she wanted to look at alcohol awareness amongst various stakeholders when it comes to older adults, namely pharmacists, because the pharmacies are the point of contact for all the people in the community and medications. And pharmacists are aware that there are serious interactions between alcohol and medications, but the question is, are they able to convey that to the person picking up the medications?
So if you got these 80-year-old folks showing up to pick up their medications, do they know they're not supposed to drink while they're taking them? Is that the bottom line?
And vice versa.
Okay.
Does the pharmacist or the healthcare provider know that the 80-year-old's using alcohol? And with the aging boomers, that's becoming a very significant problem.
Okay. So what'd you find, Rachel? What'd you find in this?
Yeah, so
study?
we interviewed primarily pharmacists in Kentucky, Maryland, and Virginia to get their perspective on would it be feasible to employ some sort of intervention when an 80-year-old comes in to pick up their medication. You know, their first contact is with the pharmacist and pharmacy staff. And so can the pharmacy provide education to the individual to make sure that they are either not mixing alcohol with their medications or safely consuming alcohol with their medications, and just having a conversation about that.
Okay. And so, again, what you went to these 3 states, pharmacists in these 3 states, what'd they tell you? I mean, did they say, oh, yeah, you know what, I kind of skip that step sometimes when these 80-year-olds come to the counter at the pharmacy?
Yeah, well, you know, I think one of the biggest concerns that pharmacists have is they're stretched so thin already, trying to get all the medications and take care, especially community pharmacies. That's one of the main points of care for a lot of individuals in rural areas. And so finding the time to be able to have this conversation with patients as they come in was one of the major barriers. But they did mention some ideas like television programming, saying, you know, putting out TV announcements saying, hey, you know, you should have this conversation. You should be aware if the medications you're taking can possibly interact with alcohol in a negative way. And when we're talking about alcohol medication interactions, it's not just these minor interactions that we're concerned about, a headache, upset stomach. They can be life-threatening. They can be life-threatening, and it can threaten someone's autonomy. You know, they could have a fall and then have to rely on someone to drive them around. And so we really want individuals to be aware about that and have a conversation with their pharmacist.
That was Rachel Vickers-Smith. She's an assistant professor in UofL School of Nursing, and she's here along with Dee Antimisiaris, who is an associate professor of pharmacology in the School of Medicine. And we're talking about this study of actually talking to pharmacists about how they deal with the patients who come in, older patients who come in, to pick up their drugs, and whether they're going home and drinking with their drugs when they're not supposed to, right? And, you know, when you're looking at these pharmacists, like you said, Rachel, that they are overworked sometimes, and they've got so many people waiting at the counter to pick up their drugs and those kinds of things that they just don't have the time to do that. But it says on the bottle, doesn't it? Won't it normally say on the bottle, do not take with alcohol?
Yes.
Yeah.
Yes, and so the study kind of reflected that idea that they're too busy to do what they're supposed to, and the whole reason is incentive, you know, pay and incentives. They really don't get paid to stop and talk one-on-one. So they can give the warning to the patient, but they can really have no mechanism to find out how much alcohol is really being consumed. So, for example, you might be able to have a glass of wine with dinner now and again with your medicine safely. But if the person's really taking 2 or 3 glasses every night and we don't know it, then next thing you know, they show up in the ER, and that's where it's discovered.
Right. And it's worse, I guess, for an older person than it would be for a younger person if they have a bad interaction with alcohol and their drugs, right?
It can
I
be,
assume.
certainly. It can be, certainly. But I think also older adults are taking more drugs. There's more polypharmacy with older adults. And so you have interactions with the medications themselves that are of concern. And then when you add alcohol to that mix, it can be really, as we said, life-threatening.
Well, and Mark, think back to when you were in college. You could take a Tylenol PM, a Benadryl, and maybe have a couple of drinks, and you survived it, right? You woke up and you didn't feel too good the next day. But an older adult who would do that has no physiological reserve and probably would leave the house in the ambulance.
Yeah, that's what I was getting at. With the younger adults can withstand something like that a little bit better. And what are we talking about here in terms of interactions? You said some could be life-threatening. Is there an example of a drug that perhaps, if you go home and have it with a couple of cocktails and you're 80 years old and don't have the physiological makeup, you can't handle it, and you maybe, as you said, in an ambulance?
Yeah, well, let's say that you've got heart failure or you have COPD and you already have trouble getting enough oxygen around your body. And then you're taking opioid, the classic opioid and alcohol combination. Opioids slow your breathing. Alcohol is a sedative. It kind of slows your breathing. And all of a sudden, somebody could go into respiratory arrest. So it's that mixture of many factors. That's why it's so important in older adults.
We're talking with Antimisiaris and Rachel Vickers-Smith from the University of Louisville about their study that they did on older adults, polypharmacy, and mixing it with alcohol. Also, isn't there a problem, or perhaps a problem, that you can't identify older folks who may have mixed their alcohol with their drugs because as you get older, you're a little more sluggish, perhaps, and you don't have that vibrancy. So they just look, it's just, it's Mr. Smith. He's an old guy. He just acts that way all the time. So you can't identify it, that there was a problem?
So one of the hard things about substance use disorders and alcohol use in older adults is, first of all, they don't show up to work every day. And they have lots of reasons to look impaired. Like you said, it could be underlying disease states that make you a little slow. So people don't tend to fully appreciate how much substance use disorder goes on in older adults. And that's why studies like this are really important. It's interdisciplinary. Rachel's an epidemiologist, right? Without that skill, and then this social work approach and healthcare approach to actually paint a picture of what's going on, it's not on the radar of the healthcare system. Because of what you said, you see an older adult and you think, they're just like that all the time.
Yeah. So what's come out of it? Or what's come out of it so far, out of this study, and what would you like to come out of it?
Yeah, so the next steps, there's an intervention being planned to implement within pharmacies and get that conversation started in a way that is time effective for both the patient and the pharmacy staff and not creating too much of a burden. And so that work is going on with FICA Zanjani in Virginia.
And here's an interdisciplinary team. It won't happen without that. They're going to need pharmacoeconomics people and healthcare system people to figure out how to create the financial incentives to make it happen.
Yeah, because a pharmacist isn't going to do something if they can plow through 15 patients in 15 minutes. Why take the time? Why take 2 minutes to help the 80-year-old Mr. Smith? Right?
Yeah, they'll get in trouble if they stop.
Right.
And they by their bosses.
Right. I know U of L doesn't have a pharmacy school, but UK does. And is there any push to get these pharmacy schools around the country to teach their students as they're going through this that this is a potential problem?
Well, actually, I'm the chair of our National Education and Research Association. It's a pharmacist association. And part of it is getting this in the literature so that we can have the discussion. Once that happens, then the associations in the schools bring it up to the political level. And once something's mandated, then it happens. Or if we can find an economic reason.
When it's mandated, it does happen. But getting it mandated is a tougher part.
Yes.
Because there's a lot that pharmacists have on their mind too. This is just one thing, right? That they're dealing with, right? A lot of times you're dealing with a language barrier. Sometimes when folks walk up to the pharmacy, it's not just having to deal with a person that has senior moments, right?
Correct.
So,
Yeah, there's health literacy problems and also language barriers too, as we have more individuals coming in who speak languages other than English.
All right. Well, I hope this produces something down the road. As you said, a mandate, perhaps. All right. Rachel Vickers-Smith, Antimisiaris from the University of Louisville. Appreciate you being on the show. Dr. Bahaa Alsoufi is the chief of the Division of Pediatric Cardiac Surgery with UofL Physicians, and he practices at Norton Children's Hospital. And he is using engineering 3D printing to help with congenital heart surgery. Dr. Alsoufi, good to see you.
Good to see you too. Thank you.
So you're relatively new to Louisville, right?
Yes, I started in July as a new chief of the Division of Cardiothoracic Surgery, Pediatric Cardiothoracic Surgery.
And you came from where?
I was before that working at Emory University and Children's Healthcare of Atlanta in Atlanta, obviously.
Well, the traffic's better in Louisville.
Yeah,
Have you found that to be true? It's a whole lot easier to get to work in the morning
Absolutely,
than it is in Atlanta.
Much easier.
All right. Well, let's talk about 3D printing and using it in heart surgery. You've done a little bit of work with this. So tell us about it.
Well, to begin with, 3D printing is, as probably everybody knows, it's like the process of printing or creating a three-dimensional solid object based on a digital model. And that is usually done under computer control. So what it does, we choose a certain material, and the printer will add layer over a layer until eventually you get the
solid
shape,
object.
the solid that matches that digital form. And that allows us to create very complex shapes that in a much easier way than the usual traditional manufacturing methods. It's not a very new technology. It has existed since the 1980s. However, it has not. It's only recently has started to almost reach its full potentials.
Right. People have really started applying using these 3D printers
Right.
to make objects. And in fact, it was a couple of years ago, I think, that the Speed School of Engineering was printing out some 3D hearts.
Exactly. Yep.
So that surgeons,
Right.
and maybe we're going to get into
Yeah,
that, so that surgeons can look at it and say,
Right.
oh, well, I got to cut this little area out, and I can
Yeah.
kind of practice before I go into the
Exactly.
body.
That's one of the applications. Now it has expanded to even to become more therapeutic as well. It's been used all over the place. Still, I think the most utility is in this industry or technology. However, probably almost 10% of the utility of 3D printing now is in healthcare. So that has expanded. And I think having new printers, having access to those printers in institutions, academic or health institutions have given physicians and others opportunity to explore ways to help patients.
Right. Well, we're talking with Dr. Bahaa Alsoufi. He's the chief of the Division of Pediatric Cardiac Surgery with UofL Physicians, and he practices at Norton Children's Hospital. We're talking about 3D printing and how that can help in healthcare. So you're a surgeon, right?
Yeah.
So do you go to the Speed School or someplace and say, hey, print me out a heart or a liver or something, and so I can look at it before
we are doing that in some of the most complex cases. I'm a congenital heart surgeon, and congenital heart defects vary. Some of them are simpler than others, but some of them are very complex. And we have advanced imaging modalities right now that we can sort of know what's going on. However, sometimes it helps a lot to actually have a model of that heart, individual patient's heart, so you can actually see the defect, see what you need to do, see how you want to access it. And you have alluded that you've had somebody a couple of years ago come in
Right.
and talk about that. So that's one of the utilities of 3D printing now. For the most complex cases, we have very advanced imaging. We can create the digital 3D model, and then we can actually print it and actually look at it. It helps in different ways. First, the simplest way is just like for education, to explain it to families, to explain it to anybody else who's going to contribute to the care of those patients with you. But more importantly for me as a surgeon, I can see the spatial relationship between what I want to do and all the other organs. Then I can actually do if I'm gonna put a patch inside.
It's kind of a
heart,
practice.
Yeah, practice, test what kind of surgery I want to do, and see if that works in real heart. And in some study in Europe where they looked at 40 consecutive cases where they had planned the surgery, then they did the 3D printing, and looked if that surgery that we had planned is that gonna work? And they found that in almost half of those cases, they had to change the planned surgery based on the 3D printing. So it gives you some extra information. Again, it doesn't need to be done in all our patients, but probably in the most complex ones.
So it can be very helpful for surgeons, though, that they can look at these potentially complex cases in a 3D printed plastic, I'm going to call it plastic, or rubberized model, and say, you know what, we were going to go in through this ventricle, but that's not going to work. We probably need to go in by the bottom here.
It can change the way you access it, as you said, or it can change, the whole procedure. And I think also it's good for training. So some of those most complex defects are not very common. And, I've been doing for a long time. I probably can do any complex surgery and do it well. However, that's not the case when you're fresh out of training. So if you have this model and you can practice on this rare lesion, on that model, probably those people who are coming out of training are more prepared to tackle it in real life.
Gotcha.
So I think it's good for training. But that's only one aspect of how we use 3D printing.
Last question. What do you see as the future of 3D printing for congenital heart disease surgeries?
Well, what we talked about is interesting, but I think what is happening, the other major area where we're using 3D printing is the most exciting and the most promising, and that is now in the printing of implants and devices that are specific to this patient. This is a very problematic, especially in the younger kids, if you're gonna do a certain device, mechanical assist device for heart failure, or you want to put an implant, you want to plug a hole, you want to do whatever. There's no one device that fits all. So now you can print specific, individualized, unique device that is specific to the patient. And this is the most important advancement right now in 3D technology, and I think that's the one that has most promise. It has tackled already some of the many major problems that we have with, for example, the bronchomalacia, which used to be a very difficult problem to treat. Now we are able to print scaffolds that are that help keeping that bronchus open, and that has remarkably improved the outcomes of those patients. So, similar to this problem, we can use the devices and implants to tackle many of those problems.
So the bottom line for those of us who are old enough to remember the old Jarvik 7 hearts and the assist devices that Lehman Gray, Dr. Lehman Gray from UofL put together, those are going out. What's coming in is these newfangled individualized plastic or rubber or whatever the 3D printing is making out of them for each individual child or adult to assist in their heart pumping. Right?
I think that's a future promise. For assist device, especially for kids, you don't, the Jarvik was it's a bulky device.
That's the one I can remember.
Yeah, absolutely. But now you can actually create a small device that is good for kids. And one last thing is just also what's important is the material that you use. So you can use a material that static, that stays forever, but you can also use some biodegradable material. Because sometimes you want to put an implant in the kid, but you don't want it to stay forever because the kid's gonna grow. So you want it to serve a purpose, but also eventually disappear. So now you can use a material that's biodegradable. It serves the purpose for a year or two or whatever you want to achieve, but eventually the body will absorb it, and then you don't have to worry about removing it. So there's a lot of work, but a lot of promise for this 3D technology.
Very, very cool. Dr. Bahaa Alsoufi, you can find him at UofL Physicians. Last name is Alsoufi. If you want to track him down and your kid has a heart problem that you need some surgery on, he's the guy to track down. Dr. Alsoufi, appreciate you being on the show.
Thank you very much.
Thanks for listening to UofL Today with Mark Hebert, and go Cards.